this afternoon, we are honored to have an expert on the talk, to give the talk, one of our most beloved and esteemed colleague in the practice of occupational health and safety, to talk on occupational safety and health as a fundamental principle and rights at work. You see, rights is different from privilege. No? So we are honored to have, let me read her credentials, the Executive Director, Occupational Safety and Health Center, Department of Labor and Employment. She has a Master's in Occupational Health from UP College of Public and Health, and she is a SEAMO scholar at that. She has postgraduate academic units in occupational health and safety from the University of Minnesota, Minneapolis, USA. Without further ado, ladies and gentlemen, colleagues, friends, we are honored to have, please welcome Dr. Maria Teresita S. Cucueco.
Reporting. Good afternoon, and thank you for inviting the DOLE to your second virtual OH conference. We have always been with you in your conferences from face to face. I think last year was the first virtual, and we hope we have given you the sharing or learnings on occupational health, safety and health on issuances. This afternoon, we are going to share with you an issuance that has international dimensions, because in the International Labor Conference held last June, safety and health has been recognized as one of the fundamental rights and principles of work. Let me further expound as I will now share my screen to provide you with this update. So, like I mentioned earlier, the International Labor Organization, through the International Labor Conference, this is an annual event held by the ILO with all international bodies in attendance, especially on with regards labor. The Ministry of Labor representatives are there. And they pushed forward with a very important resolution recognizing safety and health as one of the fundamental principles and rights at work. So where are we coming from? Actually, if you look at several international declarations on the rights to safe and healthy working conditions, there have been many addressing safety and health. It even started in 1919 with the ILO Constitution that provides the protection of workers against sickness, disease, injury arising out of and from employment. And this again was born because during that early period of the 1919, with Industrial Revolution happening, we knew that the world of work was very, very precarious. There were vulnerable workers. There were hazardous types of work, but it recognizes that workers should be protected. Then in 1944, in the Philadelphia Declaration, this provided adequate protection for the life and health of all workers in all occupations. And the Universal Declaration of Human Rights in 1948 specifically mentioned that everyone has the right to work, to free choice of employment, but to just and favorable conditions of work, and to protection against unemployment. There have been others that continue to provide the right to safe and healthy working conditions. And in 1976, as you see in all of these declarations, you will note that it is now looking at conditions of work in this International Convention of the Economic, Social, Cultural Rights, conditions of work which ensure safe and healthy working conditions. In the UN Committee on Economic and Social and Cultural Rights in 2016, it now talks of preventing occupational accidents and diseases with as a fundamental aspect to right to just and favorable conditions of work. And in 2019, the ILO already forwarded this declaration for the future of work and saying that safe and healthy working conditions are fundamental to decent work. This is so important because we know that accidents and injuries, which happens because of work, should have the necessary protection and prevention mechanisms. We are seeing a lot of statistics which are, when we look at it, which can be and should be prevented. We talk of 2.9 million deaths due to accidents and diseases globally. We talk of 402 million non-fatal occupational injuries globally. And we also have a cost that 5.4% of the global GDP is lost because of occupational accidents. Here you see that work-related diseases, because it's not as, the difficulty with diseases is that there's a latency period. We really do not address it immediately so that we can also manage it well early, because once we all know, we're all physicians here, once you see a work-related disease late, then we can only just do the best to prevent the protection. For injuries, the mechanisms for protection are already there, and we continue to then monitor all of our mechanisms to protect workers. But this should also happen for diseases as well. So early on, were already 4 rights and principles at work that has been declared by the ILO, and you will see and understand why they are important. The freedom of association and the effective recognition of the right to collective bargaining, because workers are always, they are in a position that they can only, they can bargain their rights to wages, to humane conditions of work. And it is so important that they are gathered, or they are collectively, I will use the term union, but some do not use the term union, but they're organized so that in a bigger setting with more voice, then they can do their bargaining for their necessary conditions of work that is due to them. Then, of course, another fundamental principle and rights at work is the elimination of forced and compulsory labor. We all know that this is so important. The effective abolition of child labor. We want to take care that our children should not really work early. We know that these economic conditions may not say that, but we will try everything so that they are developed fully. And when they are in the stage where they have the necessary skills, the education, they can have good jobs that would provide for them and their family. And of the latest before this one was the elimination of discrimination with respect to employment and occupation. We really are against any form of discrimination. And finally, last June, it was in a resolution, it was already promoted that the 5th fundamental principle and rights at work would be to a safe and healthy working condition. Early on, I was asking that, sana noon pa, because we know how important safety and health is in terms of providing the necessary conditions at work so that we continue to work in an environment that will not affect our health, whether it's physical, mental, spiritual health, but will promote and help us grow as we are also in the world of work. There are many ILO OSH conventions that have already been put forward. You know, the conventions, the ILO has all of this, but it depends on the member states, the Philippines being one of the member states, to see if we can ratify. What is ratification? It's looking at the convention and seeing if we are now, if or we can be able to ratify, looking at all the terms that are present in the convention. So we have the different conventions that look at the principles on OSH, the OSH management systems, and these are found in these conventions, C155, Convention 155, which is the Occupational Safety and Health Convention. This was still in 1981, but it provides the adoption of a national safety and health policy and action taken by governments, employers, enterprises, of course, and the workers as well, to promote safety and health to improve working conditions. It does emphasize this convention will look at the duties and responsibilities of employers, but it also provides emphasis the cooperation, collaboration between management and workers towards providing the necessary arrangement so that you will have good working conditions that would promote safety and health. And safety and health measures shall not involve any cost to the workers. When this was discussed, I still remember this in the late 1990s, early 2000, the employers were a bit hesitant because there was so much responsibility. But you will see that later, as we have the law, the Republic Act 11058 and its IRR, this convention can already be ratified by the Philippines. We also have another Safety and Health Convention, which is the Occupational Health Services Convention of 1985, which looks at safety and OH services that should be carried out by qualified occupational health personnel. It also provides that workers shall be informed of the health hazards at work and looks at a monitoring system. Again, we are also ready to ratify this, but we, of course, need to see how, the details of this convention and how prepared we are in terms of our legislation, our laws, and our issuances in ratifying this. Then this is a convention that we have ratified. This was brought out by the ILO in 2006, which is really just a promotional framework. It just gives you a frame, a guide on safety and health. But in that guide, it talks of several items, several conditions, like the national OSH program, a policy that should be implemented and monitored in consultation by the employers and workers. And it should contain information and advisory services, trainings, research, compliance. And you see that we are definitely, we have ratified this because the Philippines can really now and has been implementing this convention. So of the three conventions I mentioned earlier, this C187 has been ratified by the Philippines. What does ratification mean? It means that when the Philippines gives it and says we are ratifying this to the international body, which is the ILO, we are going to report to them regularly on our implementing mechanisms and how far, and monitoring all of the items in the convention and saying we are making sure that all the items in this convention are being implemented and complied with. So it is really looking at, for the DOLE, three agencies. Of course, the safety and health, because here, as you mentioned, as I showed you earlier in 187, it talks of training, research, the information, so that's advocacy. But the policy will come from the Bureau of Working Condition, and that was why the IRR of the law was developed in consultation of the BWC, did the groundwork to consult our stakeholders and provided the Department Order 198. And of course, the ECC looking at mechanisms for compensation of work-related injuries and illness and the rehabilitation program. And definitely for the BWC, the compliance of how the companies are implementing this is also very important. So we have the labor code, we have our standards. This was early on, but now we do have the law and the IRR. And the law and the IRR talks of these policies and the safety and health programs that should be complied with by all companies. It's there, it's very specific. And that is why with what is mentioned in the law, the Philippines supported that this convention, that the resolution to make safety and health as a fundamental rights and principles at work was voted and approved, was also favorably voted for by the Philippines. Now, going to the standards and knowing also COVID, we have all of this in place. The department orders that talks of the programs, the policies, even penalties if they're not complied with. With COVID, we have further looked into issuances that would provide the necessary prevention programs so that we can reduce the risk of transmission to COVID, and that there was also a monitoring systems in place for companies to report early on. Now it's just part of the bigger WAI report, but we did have a COVID WAI report earlier. And to just show you, to demonstrate that our inspectorate system continues to look at safety and health. This was the 2021 labor inspection, where we're of a 75,000 target, 91,000 establishments were covered. And this is the picture nationwide. And this is looking at how many were covered by industry, by the different sectors. And looking at safety and health compliance, this is really where we see that there is a big need to improve our safety and health. In the first pass of inspection, Philippines-wide, we only see 55% complying. These are already, of course, the programs that are specific in the IRR and the law of OSH. So after our findings are given to companies, we see an improvement in compliance. However, from 55, we see 66. So there is still so much more improvement that should happen. And this is what we see in terms of the violations that companies have when they are not implementing the safety and health program. They do not have the first aider, the safety officer. There is no fire safety inspection. And this is so important because, fire safety is a big issue because of fires happening in many establishments, and the damage to property and lives are always there. It's the very simple non-registration of establishments. Even this item is not complied with. But in all of this, we are trying to say we will not penalize. We will just make companies first aware of all of these violations so that they understand the importance of safety and health, that there's an important safety person who should be implementing, who should be developing a program, and who should be monitoring this, that they should be registered so that the DOLE can reach out and give them information when needed. And of course, the OSH program that should be implemented by companies. So you can see all of these violations. And if we go down to hospitals and clinics, you can see this is the latest from January to July 2022 of 744 in the healthcare industry. We see that again, 1 out of 2 are not compliant. Then for COVID monitoring naman, this is now the bigger COVID monitoring, looking at compliance with minimum public health standards. You see now a very high compliance because they understand. They all like to make sure that the COVID prevention programs are in place, and we are grateful for that. Now, we just need that it is translated to even the bigger safety and health program that should be implemented. So what are the top 5 safety and health violations? If you want to take a look at the general labor standards, which is looking at wages, the social benefits, you can take a look at that. Is the leftmost column. The middle column now again talks of what these violations are. So that's the non-provision of safety and health personnel and facilities, non-registration. By simply registering in one, they can already be compliant, but we still see that the compliance is 7 out of 10. So you still, or 8 out of 10 na, you still see 2 not complying. Then the fire safety inspection, the company OSH program that is not provided, and that they also do not have the safety and health personnel and facilities. So for COVID monitoring, that they do not observe the minimum public health standard, they do not submit, they have no company COVID program, no safety and health committee that would monitor COVID. These are again, but you see, it's very high already, the compliance. So siguro we will just see, very few healthcare industry companies that are not compliant for COVID. But for other safety and health, you would see that we still need work to do so that we can bring more of the healthcare industry to comply fully with the safety and health programs and the law. So we continue our work in terms of looking at the standards so that they can now be more relevant. We have new types of work. There are also other safety and health rules. First DOH, there's DOLE, there's civil service. All of these have to be harmonized. We have to also address this so that you will not be confused. And that is why we are also looking at how best to approach now the next safety and health standards. We continue to consult with our partners. And we are in the process of updating it. We're also comparing the standards with international standards. We are also modifying the reportorial forms and requirements to make it online. And we also have to look at what is now happening in the workplace, emerging work systems, processes brought about the pandemic, and here we talk of telework and the hybrid type of work arrangements. So these are all considered, and definitely telemedicine as a program that would address this is also now part of the standards. So this is just showing you, an overview on what is going to be new in terms of this. Once this is just a proposal, we don't know, because even 198 is being reviewed now by the senior officials of DOLE as well as the stakeholders. But we're looking at new issuances on the OSH program and risk assessment, on the rules on ergonomics, as well as disaster management. We all know that the new normal is not just COVID, but also dealing with disasters, natural and man-made. There are other technical rules that are also now part that we are proposing for scaffoldings, for crane and hoist, rope access, and turbines. The energy sector is also moving in terms of the renewable energies that must be in place, and safety and health is also another important consideration. We also have proposed sector-specific or industry-specific rules like telework, rules on OSH for special groups of workers, the women, the young workers, persons with disabilities, the kasambahay, maritime and fishing, and for the micro enterprise, because these are small enterprises. Resources are also scanty, but they have to be aware. They also have to understand how they can comply and what is best for their situation. New rules on the audiovisual, shipbuilding, ship repair, hotel, hospitality, mines, but this is now from other regulatory agencies, because safety and health is not just with the DOLE, but with other regulatory agencies as well. We have for mines, healthcare, DOH definitely will bring in their expertise here. The transport, including ports, because that will be coming from the Department of Transport, renewable energy from the DOE. So we are amending safety and health because the standards have to be relevant, effective, enforceable, responsive. Gender mainstreaming is very important as well, and it is applicable and adaptive. So we are going to be proposing this. However, it will take, again, some time as we are reviewing also the IRR. So as we are embarking on the fundamental rights and principles at work and OSH, which is now, we have to make sure that the Philippines, as we will report this to the international bodies, we are going to be compliant. We are also watching out that our industries, the micro, even the informal sector, will have the necessary awareness, understanding of how they can protect themselves. That safety and health is very important for them to continue to be productive and to continue for economies also to improve. And we will form for the OSHC that the support mechanisms for safety and health, training, information, and research will continue to be given. So again, thank you for inviting the DOLE, the OSHC. Congratulations on the second virtual OH conference. We are here for your questions. I will now end my presentation. Thank you.